I thank the gentleman from Texas and thank him for allowing me to borrow the disputed chart. One of the things that I think frustrates Americans is when they entrust elected officials with office, especially Congress. And the members of Congress forget a simple thing. We do not represent Washington to our districts. We represent our districts to Washington. And I think that that important principle is often missed in the debate we are currently having. By all objective standards, the American people want health care reform and they want it done right. And yet in the rush to misjudgment, they are very concerned that one of the truisms Americans understand will once again be proven, that no matter how bad a situation may be, Congress can still make it worse. The rush to judgment now to pass a bill before the August deadline, to me, is based upon one ineluctable fact. The more the American people learn about what's in this 1,200-page health care bill, the more they are opposed to it. Thus, if this Congress leaves without having passed a flawed health care bill that will increase costs, decrease quality, eliminate choices, and kill jobs, the American people will have time to tell their duly elected representatives what they think of this bill, and it will not be pleasant. Thus, we come to the problem before us tonight, which is the inability of members of Congress to put out a chart that shows how the process would work under this bill. The chart in question is here before us. It is on the floor of the U.S. House. It is being broadcast by C-SPAN across the country. And yet members are not allowed to put it in materials to be distributed to their constituents. I can find no logical explanation why this chart can be shown to you here, and yet cannot be shown to you in a piece of mail, in a flyer, or anything distributed out of the office of a member. And I would eagerly await the logical rationale as to why this is the case. Because quite simply, if the majority has its way and does not allow members of Congress to put forward the chart of their own 1,200-page health care plan, you will not see this chart. This is what they want you to see. This will lead no one to an informed decision about what is in the bill. This will lead no one to an informed decision about how one of the most intimate relationships they will have between themselves, their doctor, their health care insurance, will be affected by this bill. All we ask is that rather than allowing the people less information about this bill, that the majority do what is right and allow the American people time to make their own determination based upon what is in the bill, and allow them to see this chart, contact their members, tell them what they think of it, and let us come back. Let us get rid of a flawed bill, and let us come together from the center and work out for true health care reform that is right for Americans, that will decrease costs, increase quality, empower patients as consumers, and continue to make the best health care system in the world even better for all of our citizens. I yield back to the gentleman from Texas.